Joining us once again to talk about all of this, NBC News contributor, virologist, Dr. Joseph Fair. Doctor, let's talk first about this letter that was sent to the White House with some research, some information that suggested the virus potentially could be transmitted not just by a cough or a sneeze in the vicinity of someone else, but even by breathing or talking. What are the ramifications of that?
Well, first of all, let me emphasize, I read the paper and I read the letter rather, and the paper on which the letter was based. And so these studies were based in hospital rooms and by swabbing the walls of those hospital rooms. So keep in mind the people that are in those rooms are the most critically ill people with COVID-19, meaning they're going to have very labored breathing. They are going to be coughing and sneezing. And they were able to find what we call viral RNA. It's almost like if you think of a crime scene finding DNA later. It does not mean that they found infectious virus on those walls. So the letter is out of an abundance of caution, and we go back to that pre-symptomatic and asymptomatic individuals being able to transmit the virus. The letter was a way to indicate that we should be wearing these face coverings, and I used mask earlier, but let me emphasize homemade face coverings because we don't want to take away from the medical grade mask that the health care workers need most. It's a way of emphasizing that we may not know exactly how this is transmitted, but we do know it's being transmitted asymptomatically.
And also, it's not like measles or tuberculosis that's so highly contagious that it hangs in the air for hours.
Correct. From everything we know, measles, for example, can spread up to 10 feet away, and it is what we would call an airborne virus, meaning it's lighter than air and it can float in the air, and you can basically get it even if you're standing 10 feet away from someone. This, as far as we know now, and keep in mind, this is a new virus to science, so if it seems confusing, we're learning as we're going here about this virus. But as of now, this is not an airborne virus. We still think it only has to come in from direct contact, so even if you're just labored breathing, you are still expelling some droplets. So going back to earlier guidelines, if you're keeping that social distancing and if you're doing the face cover, homemade face cover with cloth, you're protecting yourself from transmitting the virus to others asymptomatically.
I know we are all learning together as this goes on. And early on, I remember hearing that if you didn't have symptoms or if you had mild symptoms, then you probably weren't transmitting that much of the virus. I actually asked Dr. Fauci about this yesterday, this new study in the journal Nature that actually showed now patients with mild symptoms can shed high levels of the virus early on.
That's right. We are, like you said, or like I said earlier, we are learning more about this as we go on because it is a new virus to humans. And we are learning in that pre-symptomatic phase and in the early symptomatic phase that you can readily transmit the virus to others.
And again, all the more reason to have that facial covering. Absolutely. So that even if you don't have symptoms, you're not spreading it. Can I ask you another thing about symptoms, actually?
Yes,
another widely carried belief is that it was fever, it was shortness of breath, it was cough. Those were the telltale coronavirus symptoms. As we now have more information, as frankly it's here in this country, are you getting a different profile of how this presents, what the symptoms might look like?
I think that's the thing that makes this virus the most scary, is it's hard to, you cannot diagnose this symptomatically. A lot of diseases, if you have a certain checklist of symptoms, you can say, I think that's influenza, or I think that, that is a rhinovirus, et cetera. With this one, the symptoms are so diverse, but I will tell you a trademark symptom, which we haven't seen really with any of those other viruses, is the loss of taste and smell. So if you do develop a sudden loss of taste and smell, there's a good indication that that might be COVID-19. So that's being added to those list of symptoms that people get. But not everyone gets a fever, not everyone gets a cough, not everyone gets all of the same symptoms. And the diversity is what's making this so hard, and it re-emphasizes our need for really broadly based diagnostics everywhere across the country. Both the acute diagnostics to tell you if you have it now, as well as the antibody-based serology, which tells you from your blood if you had it and have recovered from the virus.
Yeah, that really holds the key to moving forward collectively. Dr. Fair, always good to have you on the latest research. Thank you so much.